Hi, I'm Jodi Mullen. I'm a mental health counselor and play therapist. I've been doing both for about 25 years, and I'm going to talk to you today a little bit about the importance of play therapy and of play therapy training.
Can you describe play therapy?
It's actually not that difficult to explain play therapy. The whole idea behind anybody who does play therapy or uses play therapy as a therapeutic medium is that they believe that play is children's way of communicating. And there's lots of good science and research that show that to us. And so those of us who are trained in play therapy, we learn how to use play as a form of communication with the kids that we're working with, so that we're not limited to doing something that looks kind of weird, but is it more of an adult counseling kind of interchange where it's really based mostly on verbal expression.
So what are the benefits of play therapy?
There's so many benefits. So some of the benefits are, and it's really set up for children, so they don't walk into an office that necessarily has like the counselor's degrees on the wall and chairs that are too big for them and things that they can't touch. They walk right into a space that they recognize is for them. So I think right away from the beginning that happens. It's that play therapy is so based in the relationship between the play therapist and the child. I say all the time to my students and supervisees and other people that I train, it's not like what you do as a play therapist, it's who you are. And I think when that really comes out is that the child gets the benefit of having a safe, trustworthy adult in their lives outside of their family that they feel connected to.
If I want to work with kids, why should I get trained in play therapy?
Okay, well, I'm going to come across sounding a little bit like a play therapy snob here, but I'm okay with that. I think clinicians who don't are really remiss for a couple of reasons. One is that to just read about a type of approach without having the benefit of a training where you're asked to apply it, I think you lose a lot between here, what happens up here and understanding it and what happens here in terms of applying it. So I think that that's really a primary reason that you should do training. I also think that in training you can address some of the challenges and idiosyncrasies that come up in terms of working with children. Counseling is always improvisation, and that is definitely true for play therapy too. You never know what a child is going to do or say in a session, and so even, like I said, I've been doing this 25 years, and I had a session last week where a child said something that I was like, what? I was in shock. I couldn't believe it. Without training, it's haphazard. And even the Association for Play Therapy says in their definition of play therapy that a person who's doing it needs to be trained. I mean, it's part of the definition. All children play, like all human children play, and all even mammal children play. And so I think that if you're working with children, actually I know that if you're working with children and you don't have that training to understand and engage in that kind of communication with children, that you are missing out on a whole entire component of the way they communicate. It would be similar to if you were working with adults and you only took into consideration their verbalizations and not their body language and tone of voice and facial expressions. And also the way they learn. Like children learn almost everything through play, and so if you're not using play in a systematic way in counseling, then you're missing out on both of those components, the communicative component as well as the learning component. As somebody who did work with children for about 2 or 3 years following protocols that were designed to be used with children but weren't play therapy, they just didn't work. I really don't know how people do work with children without at least some form of play therapy as part of their work.
So what can I get out of your trainings that I can't get anywhere else?
One of the things that I think comes specific from our trainings is that the people who are training you are not just counselors or social workers or other mental health professionals. We're also all trained in play therapy. Some of the people who do the training aren't just trained in play therapy, they're also trained at the next level to do play therapy supervision, which means that they're capable of certifying people in play therapy. So the knowledge base that comes from Integrative Counseling Services is rather impressive in that way. I think also the collective of years and years and years and years of experiences and meeting lots of different challenges along the way. All of the people who provide training through us also have experience teaching graduate level courses in mental health counseling and play therapy. So we're all experienced in presenting, we're all experienced in bringing that special kind of education that needs to be applied and not just thought about to people regularly. I feel like I get too serious, like,